Hello, my name's Charlie and I'm a health visitor. Health visitors are nurses who are specially trained in children's public health, and we look after all children between the ages of 0 and 5 years old. We work with people of all ages and backgrounds, and we also work with other professionals both within the NHS and outside. These can include people like the paediatricians, speech therapists, podiatrists, and also people like social workers, nurseries and people from the local children's centre. We've also started visiting mums before they have their babies so that we can introduce ourselves in the health visiting service and do a health needs assessment. Our aim is to give you up-to-date and relevant health advice so that you can make healthy choices for your child and family. Every child has a health visitor, and how often you see them will depend on the needs of your child and of your family. We offer a universal service, so all children will be seen between 5 and 7 times between the antenatal period and between going to school at 5 years. Some of the things that the health visitors can offer advice on are things like safe sleeping, immunisations, and we can also signpost you to other sources of support if you need to. As your baby grows, we can also offer you advice on things such as dental hygiene and weaning. Some families also need extra support, for example if your child has a particular health need or if you're struggling with your own mental health. All children are called for a review at between 8 and 12 months of age, and again at 2.5. This is a developmental review and we check to make sure your child's growing and developing as they should be. We usually see families and children in their own home, but we will sometimes see them in the clinic settings too. All the information you share with us is confidential, which means we wouldn't share it unless we had your permission, unless we felt that you or your child was at risk of significant harm. We really welcome your feedback, so if there's anything that we could do to make the service better, please do let us know.